Well, for more on the diagnosis and treatment of COVID-19 in minority communities in the U.S., I'm joined live via Skype by Joseph Williams. He's Senior News Editor at U.S. News and World Report. Welcome back to the show.
Hi, thanks. Nice to be here, Rachelle.
So start off by breaking down the COVID positivity and mortality rates when it comes to Black, Latino, Asian, and indigenous communities.
Well, if we use white Americans as the baseline, African Americans are twice as likely to contract COVID and roughly twice as likely to die from COVID. And Latinos are approximately 2.5 more times likely to contract COVID and around twice as likely to die as white Americans. And as you know, we've reached almost 250, we're approaching 250,000 dead, 250,000 Americans dead right now, and the surge does not seem to be ending. Right now we have almost, we're triggering right around 1,500 or so deaths per day, and that's just with places that we know about. Significantly, what we've been reporting lately is that there's been a COVID undercount, where a lot of the cases that are being considered COVID aren't necessarily being classified as COVID deaths. So the toll almost is certainly higher, and African Americans and Latinos are at the front of the spear, so to speak, of this particular virus. They tend to get sicker more quickly and get more severely ill when they do contract the virus.
And to that point, there has been some criticism of the CDC data failing to capture the true toll that COVID is having on minority communities. Why the discrepancies? And if not the CDC, who do we turn to for accuracy?
Well, that's a very good question, and I don't think anybody has a good answer here. Basically, the CDC takes reports contributed by states, they aggregate the data, they put out the data in the weekly morbidity and mortality report. Now, there's been a lot of criticism from day one, from when this first pandemic started to be a critical situation, that the CDC was fudging the numbers because they wanted to assist in Donald Trump looking not as bad, or that the virus wasn't as severe as it is. And there also was a lot of press questions about whether or not the count of minorities in the victims and in those people who had come down with COVID were being counted accurately by states, and then for that data being forwarded to the CDC. So there have been a lot of discrepancies. None of them have been ironed out yet to our knowledge, and the count goes on.
So do we know now more about what's behind those disproportionately higher rates in minority communities?
Sure. There are a couple of really simple explanations, simple in the fact that they're easy to explain, but tragic in the fact that they're long-term problems that have yet to be addressed. In the case of Latinos, Latino Americans, basically they operate with jobs that are on the front lines of interaction with consumers. Think about people who work at grocery stores, who work at restaurants, who work cleaning office buildings and menial labor that a lot of Americans depend on. With African Americans, that's not too much different. Think retail, think municipal jobs like driving a bus or operating a garbage truck. These are jobs that are low-wage jobs that tend to concentrate in minority communities. That, coupled with the fact that minorities tend to have lower access to health care than white Americans, along with the fact that minorities tend to have more chronic diseases. Think about diabetes, about heart disease, about hypertension, about asthma, that exacerbate the problems with COVID-19. So if you set up one where you have an economic disparity on top of another where you have lower access to health care, on top of another where you have chronic diseases that occur in the community, it is a pandemic that's waiting to happen, and that hurts minority communities so much harder than it does white communities.
So you've touched on something very interesting. I mean, how deep is the impact that COVID is having on incomes among Black and brown people who are already earning less than their white counterparts even before the pandemic?
Well, that one's another long-term systemic problem. You have African Americans who work in jobs that are being shut down. Restaurants, bars, Latinos, the same thing. Office buildings where people often don't have a need for people to go in, and the staffs are being cut in different areas, and retail certainly has taken a big hit. So in a lot of sectors that are dominated by minority workers, those are frontline positions that are also being cut as the economy falters. A lot of these positions are hourly wage jobs. They don't have a whole lot of health benefits there, and you're facing the pandemic with a lot of single-parent households, or a lot of households that are underfinanced, that can't make ends meet even before, struggling to make ends meet even before the pandemic, and now are struggling even more so now that the economy has hit a very rough patch, and an extended rough patch from all appearances.
And I also want to get to, of course, the distribution of the vaccine. I mean, not everyone is familiar with how the historic distrust of the U.S. government and vaccines came to be here, specifically when it comes to Black and Native communities. Just quickly break that down for our international audience and why that's going to be particularly important in this situation.
Well, there's been a historic gap between the trust the African-American community has for the medical community, medical industry, and some really bad things that the medical industry has done to African Americans. I mean, we're going all the way back, even beyond the famous Tuskegee experiment, to experiments being conducted on slaves without anesthetics. We've moved forward in time, and you have the Tuskegee experiment where the government was conducting a health trial that left syphilis untreated in African American men as an experiment. Now, you couple those two major events with the fact that this virus is experimental, and with the fact that there's a lot of disconnect between African Americans and the healthcare community, then you have a recipe for people being shy to take the virus because they fear that this might be Tuskegee in the making that nobody has told them about.
And certainly we don't have any sort of long-term side effects to be able to look to. Thank you so much for your insights. Joseph Williams there, Senior News Editor at US News and World Report.